One of the biggest injuries we see to the shoulder is to the rotator cuff. The rotator cuff is actually a pretty complex structure made up of 4 muscles, 4 tendons that wrap around the shoulder and allow you to move your arm around in space in a pain-free manner. Injuries to the rotator cuff can range anywhere from a tendinitis, overuse kind of injury, to actual tears of the tendon that then can range in size, small, medium, large, and they can progress to the point where actually you can't get your arm overhead. So some of the common treatments are primarily dependent on your complaints, including pain and dysfunction. So they can start simple and easy with some rest, anti-inflammatories, and focused physical therapy, all the way to surgical repair of rotator cuff tendons. Apart from rotator cuff, frequently see folks for injuries to their proximal biceps tendon. So your biceps tendon actually runs right through the middle of the shoulder joint and can frequently be a source of pain. And then as well as to the labrum. Injuries to the labrum frequently occur after dislocations or subluxations of the shoulder, and it's a structure that helps hold your shoulder in place. So when that damage is damaged, you can have some instability in the shoulder as a result. At its most basic level, joint replacement and shoulder replacement too, for that matter, are replacing diseased cartilage and bone with metal and plastic. Now in the shoulder, we have 2 frequent shoulder replacements that we use. We call them an anatomic shoulder replacement or a reverse total shoulder replacement. In an anatomic shoulder replacement, as the name suggests, we're trying to replace the anatomy of the shoulder. That means replacing the humeral head, which is shaped like a ball and located on the arm side of the shoulder joint, with a metal ball attached to a metal stem, and replacing the socket part of the shoulder, which is attached to your shoulder blade, with a plastic dish. And that essentially recreates the anatomy that you were born with. A reverse total shoulder arthroplasty, on the other hand, is what the name suggests, the opposite of that. So we cut out the diseased bone and cartilage of the humeral head on the arm side of the bone and replace that with a plastic dish or a plastic socket attached to a metal stem on the arm bone, and then replace the socket side with a metal ball onto the shoulder blade. Shoulder replacement is a fairly personal decision, and I'm here to help you out along the way. You'll never hear from me that you need a shoulder replacement. The advice that I give patients is when you start taking off activities that you'd otherwise normally be doing, and you're not doing them anymore specifically because of pain in your shoulder, that's a time to consider shoulder replacement, be evaluated. Any number of things can cause shoulder pain, and if it's arthritis, then frequently a shoulder replacement can get you back to doing the activities you enjoy doing.